this is Dr. J back again with the Human Movement Institute, where we have improvement through movement. Today we will be discussing elbow extension self-joint mobilization for those of you who have a tight anterior capsule of the elbow or restricted muscle mobility or flexibility of the musculature in the anterior aspect of the elbow. We do need to make sure we have an accurate human movement diagnosis. For example, some people get excessive osteophyte formation on their olecranon in the posterior aspect of it, particularly with people who have repetitive throwing like pitchers. Years and years of throwing can lead to excessive bony formation in the back of the elbow and thus limit elbow extension. In this individual, if the bony formation has occurred, we will not be able to restore full elbow extension. We may be able to improve it some, but we would not expect to get it all back. Besides that person or individual, we will be able to identify a movement diagnosis where we can restore full elbow extension through self-joint mobilization. This is an alternative technique to those who aren't comfortable with a band and or getting down on your hands and knees. To do a self-elbow joint mobilization, put your palm down on a stable surface. Rotate the eye of the elbow forward or anteriorly. Next, find the olecranon, the bump on the back of the elbow, and come down just below it. You can use your own hand to work into elbow extension and flexion, and use your hand as resistance and as a mobilizer, pushing the ulna anteriorly into elbow extension. You can also rotate the eye of the elbow or the cubital fossa forward. You can even try different subtle angles like anterior medial versus anterior lateral. Next, for those who have limited elbow extension with forearm supination, don't forget the pronator teres, but anyway, we can start to mobilize into elbow extension here. Again, using my own hand, helping to rotate the forearm, the volar aspect anterior, and I can flex and extend into my own hand to help restore end range elbow extension, otherwise known as TEE, terminal elbow extension. It's essential that we maintain full range of motion over our joints to have more surface area across our lives, because the more surface area you have, and thus the more range of motion that's within normal limits, not excessive limits, helps the health of the joint and slows any degenerative process across the lifespan. So this video is designed to help people restore elbow extension. A good starting dose is to do mobilizations for 1 to 2 minutes, 2 to 3 times, once or twice a day, or until you have full elbow extension. So if you like this video, please share it with your friends, family, patients, and colleagues. Take care and see you all again soon.